Assalamualaikum warahmatullahi ta'ala barakatuhu. A pleasant day to each and everyone. By the way, I am Nur and I will be your instructor for Fundamentals of Nursing Practice NSG 120. So in this video, I will orient you, okay? Ipapakita ko sa inyo yung ating course outline para sa subject na ito. It's very important that you know that this NSG 120 is one of your major subjects for this second semester. So, you need to pass this subject, the same with the NSG 102, with the LEC and lab, and then yung may laboratory nito or the skills, kailangan may pasan yung apat na yon na mga major subjects ninyo for this SEM para makaproceed kayo to second year and you will be a candidate for our capping and badging investiture. Okay? So, yun yung mga requirements. Okay? Para klaro lang tayo, isa to sa mga requirements para maging candidate ka for capping. So, pag hindi ka nakapasa sa subject na ito, the same with your NSG 102.2 and 120.2 na NSG, hindi kayo masasali sa list of candidates ng ating capping and badging ceremony. So, ano pala tong course na ito? Okay, so NSG 120 or Fundamentals of Nursing Practice, this course provides the learners with the overview of nursing as a science, an art, a vocation, and a profession. It deals with the concept of man as holistic being comprised of biophysical and spiritual dimensions. It includes discussion on the different roles of a nurse, emphasizing health promotion, illness prevention, and alleviation of suffering and maintenance of health utilizing the nursing process. So, di ba, previous SEM, na-discuss na natin yung mga TFNs, okay? The Theoretical Foundations of Nursing. Now, ito namang mga fundamentals of nursing practice, dito kayo magsa-start, okay? Na ma-learn ano-ano yung mga dapat na mga procedures, mga roles, okay? Na ginagampanan ng mga nurses for their patients. So, students are expected to utilize the nursing process, which is yung ating 5 phases. We have the assessment, diagnosis, planning, intervention or implementation, and evaluation in the holistic care of clients for the promotion and maintenance of health, ensure a well-organized recording and reporting system, relate effectively with clients and other members of healthcare team in work situations related to nursing and health. So this is a 3 units lecture. Okay? And independent study, umaabot siya ng 20 to 30 hours, depending na lang sa ating meeting. Kasi very late na tayo nag-start with this subject. So, medyo mahaba-haba itong subject na to, but rest assured na madidiscuss ko naman yung lahat ng kailangan nyong matutunan. So, ito siya, binibigay sa level 1 during second semester. So, the prerequisite of this is the Nursing 100 and Nursing 100.2. That's why, di ba, chine-check natin no previously nung enrollment kung naipasa nyo ba yung NSG 100 and NSG 100.2 para maka-enroll kayo sa subject na ito. So, the core requisites includes the NSG 102 and NSG 102.2. So, what are the program outcomes of this course lecture? First is to apply knowledge of physical, social, natural, and health sciences and humanities in practice of nursing. So, yun yung gusto nating mangyari. Okay? Ang outcome ng program na ito. The next is perform safe, appropriate, and holistic care to individuals, families, population groups, and community utilizing the nursing process. So, ang pinakamalaking dinidiscuss dito sa ating fundamentals of nursing is the nursing process. Dito natin parang mas in-depth yung discussion natin with the nursing process because that is the fundamentals ng ating nursing practice. Ito yung pinakamalaking steps or process sa ating routine care na nakakatulong para makabigay tayo ng magandang services for our patient. Next is apply guidelines and principles of evidence-based practice in the delivery of care. Fourth, practice nursing in accordance with existing laws, legal, ethical, and moral principles. Next one, communicate effectively in speaking, writing, and presenting using culturally appropriate language. So, isa din sa mga tinuturo dito sa fundamentals of nursing is how will you deal with your patient, communicate with your patient. It is very important that as a nurse, you know how to speak, okay? For your patient, you act as an advocator, okay? You give them health education, so as much as possible you act as an educator also kasi nagbibigay ka ng mga health teachings na nakakatulong in improving their well-being. Okay? Next one is to report, document client care accurately and comprehensively. Next one is collaborate effectively with intra, and multidisciplinary and multicultural teams. Kasi syempre, hindi ikaw lang yung nag-iisa sa isang team. So you have the physicians, you have the nutritionist, you have the midwives, okay, the medtechs, at iba pang members ng ating healthcare team. Next one is to practice beginning management and leadership skills using systems approach in the delivery of client care. So dapat as early as now you know how to manage and you have these leadership skills kasi pwedeng ikaw yung mag-lead sa isang healthcare team, especially if you are assigned in community setup. Next one is engage in lifelong learning with a passion to keep current with national and global developments in general and nursing and health developments in particular. For number 10, we have demonstrate responsible citizenship and pride in being a Filipino. And lastly, to uphold the nursing core values in the practice of the profession. So, level outcomes, ano yung gusto nating mangyari? Okay, at the end of the first year, given a simulated situation in selected settings, the students demonstrate basic nursing skills in rendering safe and appropriate care utilizing the nursing process. So, yun yung pinaka-overall na gusto nating outcomes out of this course na ito para mas mabigyan kayo ng idea and knowledge, skills, and attitude in performing or demonstrating the basic nursing skills to render a safe and appropriate care. Okay, so the course outcomes, we have integrate relevant theories of nursing and the performance of different phases of nursing process. That's why it's very important na hindi nyo pa rin nakakalimutan ang mga iba't ibang theories na na-discuss during your TFN day. So we have utilized the nursing process in the care of individuals, families, population groups, and community, implement standards of evidence-based practice and translating knowledge and skills and fundamentals of nursing across all patients in a different clinical setting. Especially kayo mga students in the future, okay, once you become second year at magkaroon na kayo ng cupping, matawag na kayo ng mga student nurses, you will be able to expose in different clinical setting. As such, we have the Northern NMMC or Northern Mindanao Medical Center. So, nasa Cagayan yan siya. So, pwedeng ma-expose kayo doon. We have APMC or Amay Pakpak Medical Center. We have also the Cebu. Sa Cebu, meron tayo sa Vicente Soto. You will be exposed there also. And hopefully, pwede din tayo, sana ma-approve din yung application natin sa Davao. Okay? So, meron din tayong application doon for, para dun kayo din, isa din yun sa area na pwede kayong ma-expose. So, yun yung mga places or mga clinical setups na pwede kayong ma-expose at every hospitals have different setups, okay? Yes, alam natin na lahat yan siya hospitals, pero yung mga policies within the hospital is very different per hospital. So we have also incorporate ethical legal considerations when performing nursing procedures, observe proper communication techniques in establishing working relationship with client, significant others, and health team members. So, one key to establish trust and rapport within your patient is to have and observe proper communication. Kaya kayo, if ma-expose man kayo sa mga area na mas madami yung non-Muslims, you need to learn Bisaya. Okay? Especially pag ma-assign kayo sa Cagayan. So, kailangan talaga you're very fluent or you will able to understand basic Bisaya words, 'di ba? And then yung mga non-Muslims naman, if you will be assigned at APMC, so you need to learn more on of mga Maranao terms, okay? Dapat you will be able to speak with your patient kasi mahirap na kung hindi mo nakakausap ng maayos yung pasyente mo. Okay, next we have observe proper documentation and ensure security of information. So we need to ensure confidentiality. Dapat meron tayong confidentiality, hindi natin basta-basta na ichichika, okay, or na ichichismis yung mga kalagayan ng ating patient. Then next, recognize the importance of collaborating with intra, and multidisciplinary and multicultural teams. Appreciate the significance of being a nurse manager at the same time a leader in the different health settings. We have participate in varied continuing professional development activities, practice the core values of the Philippine nursing profession, and project the positive professional image of a Filipino nurse. So these are some of the topics or the contents that may expect nyo within this subject. So first module, i-discuss natin yung nursing as a profession. So i-define na naman natin what is a profession, okay, yung mga definition niya, criteria niya, what is nursing, okay, the characteristics, and the personal and professional qualities of a nurse. So next, we have the history of nursing. So parang naulit din, 'di ba, sa theoretical foundation of nursing, na-discuss din to siya. So review din, parang review na rin 'yun sa inyo. Then next, we have the development of modern nursing. So paano nag-start from the time ni Florence Nightingale up to this recent. Okay, we have also growth of professionalism. So ano yung mga what is profession and what are the four patterns of knowing, and then we have the overview of professional nursing practice. So meron tayong pinag-aralan natin ulit yung theory ni Patricia Benner, okay, di ba, yung mga level of proficiency. We have the novice, we have the beginner, we have the competent, proficient, and expert. We have also the roles and responsibilities of a professional nurse. You need to know that para alam natin na once maging a nurse na kayo in the future, alam niyo kung ano yung mga roles and responsibilities that is expected of you. Okay, we have scope of nursing practice based on Republic Act 9173. We have the overview of the Code of Ethics. Very important ngayon na ma-discuss sa mga students ang Code of Ethics. Okay? Pag sabihin natin ethics, it is our attitude towards our profession and our attitudes towards our patients. Okay? So, the Filipino Bill of Rights, okay? Kasi syempre, kailangan din natin alamin yung Bill of Rights ng mga taong sinuserve natin and the legal aspect. So, in times na, wag naman sana, pero pag maging future nurses kayo, at dumating sa point na may magdedemanda sa'yo and you know your legal, legal aspects of your profession, so pwede niyong ma-defend yung sarili niyo against those people na pwedeng makasakit sa inyo. So we have professional and legal and moral accountability and responsibility. So we have also fields of opportunities in nursing, such as, so ito yung mga settings na pwedeng parang specialty or mga special areas ng mga nurses. So we have in institutional nursing. Pag sabihin natin institutional nursing, sila yung mga assigned to a company, okay, pag ikaw yung mga company nurse, okay, we have hospital staff nursing, syempre, yung sa mga hospital, yung mga nurses doon, we have community health nursing, it's either nasa school ka, nasa iba't ibang companies or plantilla ka, you are in the public health, okay, and then we have independent nursing practice, and we have also nursing and education. Katulad ko, I'm a nurse and education, so I'm a nurse educator. And also nursing in other fields. So is another din na i-discuss natin is communication skills. So how to have an effective communication, the purposes of therapeutic communication. So, ang tinatawag natin sa communication skills na meron tayo is therapeutic communication. It is a type of communication with your patient that has a good benefit. Okay? So we have components of communication, the criteria for effective verbal communication, the guidelines, the use of touch, okay, the developmental consideration of communication, and paano ka makipag-communicate with your patient who are physically challenged, okay? Yung pag sabihin natin physically challenged, may pagkukulang sa kanilang pangatawan, if they are persons with disabilities, okay, they have, or if they are cognitively challenged, meaning meron silang problems with their cognition or with their mental state, and we have also aggressive patients. And then general guidelines for transcultural therapeutic communication. It's very important that we respect different cultures in this profession. So, and i-discuss din natin yung nursing process, which is yung ating 5 phases: the assessment, diagnosis or nursing diagnosis, the planning, intervention, and evaluation. And we will also discuss for documentation. And another din na topic na i-discuss natin, we have the health and illness. Okay, ano ba yung definition ng health? Okay, ano yung mga dimensions ng wellness? Ano yung definition ng illness? Okay, mga levels of prevention. We have also here the levels of care. Okay, sila yung health promotion, disease prevention, health maintenance, curative, and rehabilitative. We have also basic interventions such as para sa healthy lifestyle, oxygenation, fluids and electrolytes. We have nutrition, elimination, temperature regulation, mobility and exercise, hygiene and comfort, safety, security and privacy, psychosocial and spiritual concerns, and care of the client in pain and in surgery. Okay? And then we have also meeting the needs related to the death and dying or grief or grieving. Okay? Kasi may mamimit din tayong mga patient na in the time na malapit ng mamatay or naka-experience na may relatives or mother, father na namatay. So, the concept of death, i-discuss natin yan. We have the care for terminally ill patients and their families, and also the post-mortem care. So, for Module 2, the nursing as an art. So, paano siya na-define as an art? Okay, bakit siya natawag na art? Okay? At hindi lang siya science but also an art. The concept related to art as art of nursing, the self-awareness concept, the self-enhancement, the caring, the nurse-client relationship, and the therapeutic communication. So, as of now, dahil ang na-approve na limited face-to-face is for skills muna. So, let's just wait for other memos to come. Hopefully, makakabalik din tayo sa face-to-face na setup. But ngayon, dahil hindi pa naman lumabas yung memo na pwede tayong mag face-to-face for lectures, so online, purely online tayo. It's either synchronous or asynchronous. Okay? So, pag synchronous, it's either through Google Meet or Zoom. And then, pag asynchronous, magpo-post na ako ng mga lecture videos ko in our FB page. I will just post, okay, the, link, okay, share the link sa ating Google Classroom kung saan mapapanood ninyo yung video, or pwede kong i-share ito via YouTube channel. Okay, so gagawa na lang ako ng YouTube channel ko para every now and then napapanood nyo. Okay, so ano yung mga resources na gagamitin ko for our fundamentals of nursing? Malaking sources na gagamitin ko, libro, is yung kay Kuzier. Okay? Yan yung malaking sources ko. We have the volume 1 and volume 2. So, we have also online journals, online video clips. Okay, we have manual of nursing procedures and major laboratory skills set. So, the course requirements, ito yung mga kailangan na makumpleto ninyo. First is the class attendance and participation. Syempre, it is online. So, dito natin makita yung if you watch my videos and then you appreciate my videos. And dito sa class attendance and participation, in every lecture video na ina-upload ko, I want you to comment down at least one of the topics that I have discussed and give your insight about it. Or kung gusto mo, in conclusion, ano yung natutunan mo as a whole in watching my lecture video. So that serves as an attendance and participation. We have also quizzes or activities. Pwedeng magbigay ako ng mga activities day-to-day or depende. Okay, pwedeng isa for prelim, dalawa for midterm, and then tatlo for finals, depende sa division. And we have also requirements. Example lang natin, pwede tayong magkaroon ng journal sharing. Okay, video presentation or reporting. Pwede yan siya. Yan yung mga pwedeng gawin natin ng mga activities. And for long exams, syempre meron tayong prelim, midterm, and final. So this is my grading system for class attendance and participation. It's either asynchronous or synchronous. Again, ang pag-a-assess ko ng class attendance for as asynchronous is if you watch my video and you will comment on that video. Okay, sa comment section nung aking pag-upload, sasabihin mo yung na-learn mo out of the video or at least discuss one topic na nasabi ko doon sa video, and then brief lang, hindi masyadong mahaba, hindi kailangan na sobrang haba. That is 10%. Next one is for quizzes or day-to-day activities. We have 40%. Okay, requirements. Okay, 10%. And lastly, for long exams, 40%. And also, ang ating grading system is divided, yan siya. Pag prelim, okay, that is 30% of 100% of the total grade. Okay, pag midterm, 30% din of the total grade. And pag finals, 40%. So, meaning nito, example lang natin, for prelim, yung overall na grade mo dyan, ita-times natin sa 30%. At kung ano yung man yung magiging kalalabasan nun, yun ang total grade mo for prelim. And then, next naman sa midterm, ita-times din natin siya, the same lang din, ita-times din natin siya sa 30%. Kung ano yung makuha nating number, yun ang final grade mo for midterm. And then also for finals, mas malaki kasi 40%. A total of 100%. So, ipag-plus natin yan, ipag-add natin yan siya pag sa overall or total grade, and then i-divide natin to 3. Okay? So, yan ang ginagawa ko for our grading system. Okay? Para clear sa inyo at hindi na kayo magko-question na bakit ganito yung naging grades niyo with regard sa itong subject. So, ito yung mga references nga na libro. We have Fundamentals of Nursing by Kojir and Herbs. We have Association of Deans, the Resource Manual. We have Basic Concepts in Nursing 100. We have Understanding the Nursing Process by McGraw-Hill Professions Division. We have Mosby, Elsevier, Fundamentals in Nursing 7th edition by Potter and Griffin, and Mastering Fundamentals of Nursing, the Concepts and Clinical Application, 2nd edition. So, yan yung mga ilan sa mga reference ko. Bali kasi, I'm on basing on, my discussion will be based on a PowerPoint presentation. So, if sabihin niyo sa akin, ma'am, kailangan po ba makabili kami ng libro? It's up to you kung gusto niyo magbili ng books para meron din kayong basis at napag-aaralan. Or kung ayaw nyo naman, that's fine with me for as long as you can follow with my discussion for our lecture. So, I think that's all for the orientation of this course outline para sa ating NSG 120 Fundamentals. Okay? So, remember that you need to complete all the course requirements na nasabi ko para pumasa. Pag sabihin kong pumasa, umabot ng 3 yung grade. Hindi dahil na-complete nyo yan, flat 1 na yung grading nyo. Hindi ganon. Kasi we have the rubrics. Okay? We have this one na still pa rin magbe-base ako if perfect ba yung attendance mo, if yung activities na binibigay ko sa inyo ay napa-perfect nyo ba. Kasi syempre, kung magbibigay din naman pala, example lang, magbigay ako ng essay, tapos, di ba yung essay, expected yan siya ng umaabot ng ilang paragraphs kasi you discuss your points. Paano kung magbigay ka sa akin ng essay, 2 sentences lang? That's not a paragraph. That's just yan na isang sentence lang, dalawang sentence lang. So, hindi maganda yung magiging score mo doon. So, example lang din kung masyadong kinopya. Okay, kinopya sa kaklase, kinopya sa internet, na as in the whole, hindi pa inedit. So, may mga minus din yun. Okay? May mga deduction. And also, if late ka in submission, okay, parang ngayon day na to, binigay ko yung activities, tapos isasubmit mo yung activities sa akin pagpatapos na yung semester. So, syempre, hindi ko na yun siya i-accept. Masyado namang late yun. Okay? So, na-accept ko pa rin yung late, pero as much as possible, every nalilate ka, every example, na-late ka ng ilang araw, may minus, may deduction yan siya. To be fair naman sa mga kaklase ninyong nakakasubmit on time. And also for the requirements, syempre dapat maganda din yung mga outputs ninyo. Para hindi nyo masabi na, ma'am, bakit ganun? Kompleto naman po yung attachments ko, but maliliit po yung grado ko, or bakit maliit po yung grado ko. Tingnan nyo din kung ano yung mga result ng grades ninyo. Okay? Hindi natin masabi na dahil nag-attach ka lang, sige lang, hindi naman yan i-check ni ma'am. Chine-check ko talaga yan para makita natin na kung ano ba talaga yung naiintindihan mo sa subject na ito. Okay? So, thank you for watching this video. I hope this is very clear to you at wala na tayong mga questions, clarifications. If naman meron pa rin tayong mga questions and clarifications, you can comment on this video or you can just PM me sa aking personal account, okay, para mapag-usapan natin yung queries ninyo. Okay, so thank you for watching this video and wassalam.